Well, it's kind of like dancing on the head of a pin in some ways because sure you want to be proactive and you get these results. For example, when those essential caregivers did have a detected COVID, it took us 45 minutes to move 11, well, actually a total of 17 residents into our isolation unit. So we acted very, very quickly. The issue, of course, is that until we can educate people on what's really going on, and the pattern has been always, when and staff know it and families know it, they just get retested and it's all clear. So it was a bit of a shock for people when this was declared. And then adding to that shock, when people were retested, without exception, they've come back negative. So
Do you wish the health unit's approach was different?
I wish that my wish would be there would be more communication with us about when this change in protocol changed, when it went from a simple retest to now, and I understand they're trying. There's a link to the VOC, which we completely understand, but a little more dialogue and communication on and working together, I think it would have gone a long way, I think.
Now, you've been in contact with Dr. Chirko in the health unit. Have you made any headway in getting this kind of resolved?
Well, it's a part of the protocol from the province of Ontario that we have a daily meeting with the hospital, Ontario Health, the health unit, and obviously members of our team to go through this. And all the first request was, could we possibly get those remaining couple of essential caregivers tested? You can imagine if you are a senior, and most of them are seniors, sitting at home, understanding that some people were tested, they don't have the ability to test, that it's very anxious for people. It's a very tough time for people to be sitting at their home, and quite frankly, they were told not to leave. They could face a fine, so they're seniors. Do they have those supports in front of them? Do they have a way to get food, their medication? So we thought if we could get them at least tested, a mobile team to go out there, it would at least reduce some of that stress for them. And that was not recommended or supported by the health unit.